A doctor at a government hospital in Chennai was stabbed multiple times by the son of a patient he was treating, allegedly over grievances on treatment to his mother suffering from cancer. The doctor is in ICU, and the incident has led to protests by doctors at the Kalaignar Centenary Super Speciality Hospital, with Tamil Nadu Deputy Chief Minister Udhayanidhi Stalin trying to pacify the angry doctors. Workplace violence in the health sector has been a subject of common concern around the world in recent years. It has become a global public health issue that severely endangers the health of medical workers and threatens the quality of medical services. Several incidents have surfaced in recent times. In July, a senior doctor and professor at Lucknow's King George Medical University was brutally beaten by relatives of a deceased patient. In September, a doctor at a private hospital in Gujarat was allegedly assaulted by 3 people after he requested them to remove their footwear before entering the emergency room. In 2017, it was reported that nearly 75% of doctors in India have faced some form of physical or verbal violence during their lifetime. About 70% doctors feel unsafe while treating a patient. Another study carried out in Kerala discovered that there were 137 documented attacks on physicians in 2022. Respondents stated that violations occurred as a result of patient dissatisfaction, long waiting times due to inadequate staffing, improper communication, lack of medicines or other adequate facilities, and frustration with the healthcare system. But what does it take for a doctor to work under such threatening circumstances?
Definitely, because these kind of issues are creating a real fear among doctors whether to do this profession, whether to continue this profession or not. Being a gynecologist, really we are worried. Anybody can attack at any time, means that how can you work in the hospitals? And the hospital and our service is totally very close to the patient, and we need to work like that in a very close environment. So anybody can do anything, and anybody can enter into any place of the hospital at any time.
A survey by the Indian Medical Association shows that over 82% doctors feel stressed out in profession, around 63% fear violence, and 46% say violence is the main cause of their stress. Medical personnel who perform night shifts, especially female doctors, encounter security-related problems, as evident from the R.G. Kar rape and murder case in Kolkata. In India, violence against healthcare professionals is a startlingly frequent occurrence. Statistics show a trend toward increased hostility, especially in public hospitals. Perhaps a part of the solution is to educate patients better on the treatment and for hospitals to have a standard operating procedure in place to handle situations like this.
Safety and security committee should be formed in each and every hospital that they have accepted. Or a police outpost should be maintained in all hospitals. They have accepted for that also. So we hope that they will do that. Government should take adequate steps to provide security and safety, especially in all hospitals, not only private or government, to hospitals. That is the main demand. Then national level act is needed. For that, central government should bring a national act without affecting the state rights. That is very, very important because health is in the state subject, So central government should bring an act without affecting states' rights.
It is painful for anybody to lose their loved ones, especially when a medical attempt is made to save the life. But reality is that doctors are only human and can only do so much. Although there are numerous cases of medical negligence, it is important not to lose faith in doctors or the medical profession.